So, as we kind of go along and think about this, I think you mentioned earlier, what are the genetic changes that may increase your risk for ovarian cancer?
Yeah, so I mentioned earlier, we talked about a particular set of genes. There are two different ones, BRCA1 and 2. And these genes are really important part of what our cells do normally to keep our bodies healthy. But when we have changes or mutations in these genes, they can put us at increased risk for ovarian cancer. They may also put us at increased risk for other types of cancer, specifically breast cancer is the one that's most common that we think of. And these are changes that we actually get from either our mom or dad. So they're an inherited change in our genes. And so if we have a strong family history, these are things that we might be looking for. We know that when you have a change or a mutation in one of these genes, it puts you at increased risk not only for getting ovarian cancer, but potentially getting ovarian cancer younger than what we would see on average. We, on average, see women get ovarian cancer in their mid 60s, but women with one of these changes or mutations may be at increased risk for getting cancer in their 40s or their 50s. And so when we see women who are newly diagnosed with ovarian cancer, it's a recommendation that we undergo genetic testing to see if you may carry one of these changes or mutations in BRCA1 or 2 or some other associated genes that we don't talk about as often, but may still increase your risk or your family's risk. And this helps in multiple ways. It helps to guide particular treatment once you've been diagnosed with ovarian cancer. But just as importantly, it helps to guide additional treatment for family members so that we can screen them and look to make sure that we can intervene potentially medically or surgically for them to decrease risk for ovarian cancer, as well as other cancers that are associated with these mutations.